Hi, I'm Tony Capone. I'm president of the Pediatric Retinal Research Foundation, and we're here in the morning of our Family Connection Conference and going to talk about research while we take a stroll down to the booth. So the foundation has a long history of supporting research, as you can tell from its name. We built out a laboratory here at Oakland University called the Pediatric Retinal Research Laboratory, or PRRL. We like to call it the Pearl Lab. And in that lab, we have studied the basic mechanisms of some of the conditions that we take care of, the pediatric retinal vascular diseases, like retinopathy of prematurity, familial exudative vitreoretinopathy, and others. In that lab, for example, we did some of the work to develop a pharmaceutical that is at the cusp of entering clinical trials. We also sponsor research that starts careers, so startup in that sense. We like to give funds to help support students, kind of the phase of their career where they may decide whether or not they're interested in clinical basic science research, and then maybe going on to be healthcare providers of one sort or another. And in fact, a number of our so-called super students, that's what we call them, have gone on to careers in medicine and even careers in ophthalmology. This year, we've also started a pilot grant series, which is slightly more funding for seed ideas, things that aren't yet mature enough for folks to apply for a grant, but it allows them to kind of get the preliminary materials and get the groundwork done that will hopefully then lead to formal funding. Last year was actually our first year. This is our first renewal year, and we'll have several new pilot grant recipients this year. And we're also offering the opportunity for some folks who are doing good work and need additional funding to get an extension. So that's a brief summary of research then and now for the Pediatric Retinal Research Foundation. Thank you very much for your support.